I love thinking of art therapy as being highly experiential. And I remember you saying one time that in an art therapy session, we're offering an experience, and that embeds in the memory in a totally different way when you're offering an experience to a client.
Hello, my name is Robert Johnson, and I am the co-owner here at A Better Way Counseling. It is important to be skeptical of any mental health information you receive online, and that includes our information. Please consider the source. All our counselors are either licensed counselors, supervised associate licensed counselors, or supervised student interns. As for my credentials, I am a licensed mental health counselor with over 40 years of experience in the field. My licensure requires ongoing trainings and workshops every year. I either supervise, train, or consult with approximately 25 therapists every week. Finally, any video training is not a substitute for interactive counseling. If you believe you need counseling help, seek out a professional you can talk to directly, whether that is in person or via telehealth sessions. Thank you. We're here today with Gina Kanagawa Schwartz, who is a licensed marriage and family therapist. And tell me what ATR is.
ATR stands for Art Therapist Registered.
Yeah, I was going to mention that you are a licensed mental health therapist, licensed marriage and family therapist, and for full disclosure, Gina works in our agency. And if you want to see Gina, you got about a year waiting list.
Yeah.
Very popular therapist that plenty of parents want their children to come to, and adults want to come to also. And clearly what you're doing works and makes a difference. But I'm wondering if you could talk about that. Who can benefit from art therapy, and how do you see that it works in the therapeutic process?
Mm-hmm. That's a really good question. In my training, I was prepared to use the creative art process with a pretty big range of populations and a lot of settings as well. When I think what happens often is that when I tell people I'm an art therapist, others tend to assume that means that I work with kids and teens and do art therapy with kids and teens. I happen to do that. That's actually my specialty. I do work with kids and teens. That's a large part of my caseload. But art therapy is effective with all kinds of populations, not just with kids and teens. Art therapy can also be used with adults of all ages. I see adults, individual adults. And you can use art therapy with couples, families, which I do. I work with families with art therapy. It's a fun way to do the art therapy when you have a family group in front of you. Groups like art therapy groups. So, and you can do those with all kinds of different populations. Also, I was trained to use art therapy on a larger scale or with organizations and communities like schools. In my own practice, I use art therapy with all of my clients to some degree. So, and that's regardless of their age or their gender or their presenting issues. Right now, I mostly see kids 5 and up and also teens. I'm doing art therapy with them individually, but I'm also supporting the parents.
You work with the parents of the teen or the child, and clinicians who work with children often don't always involve the parents to the degree that probably is necessary. And I wonder if you could talk about how you work with parents, and specifically how you work with parents, and secondly, how you work with parents that are difficult to work with.
Yeah. Oh, those are great questions. Well, just generally how I work with parents using the art therapy, and working with parents is one of my favorite parts of the job, I have to say. I just really love working with parents. Maybe partly because being a parent myself, I just understand how challenging it is to be a parent, how hard it is, and how much we as parents need support. So I really highly value spending time supporting the parents because I think we need it. Like we all need it, and there's not a lot of support for parents. So that is a really important part of the work that I'm doing. The when I'm working with parents, and also if I have the whole family in front of me, which is happening frequently in my office, I'm using the creative art process as a vehicle for trying out new ways for the family members to relate, to respond to each other, to connect. We're working on communication between family members, communication between parent and child. In the earliest stages of treatment, especially the assessment phase of when I'm working with families, the directives that I'm offering up to the parents and the family. So the directives are the tasks, they're the art tasks or the art projects that I'm offering. And I like to say offer because at any point, a client may not want to take up my offer on a particular art directive, an art task, and that's okay. I really want my clients to feel very comfortable with letting me know if that's just not a direction they want to go in that particular day. So I'm offering up art directives, which are ideas of tasks that we can engage with that I think will deepen the exploration in the session. So in the assessment phase of treatment, I tend to use much more structured art directives, and structured art directives are going to be more focused. And that's where I am putting forth a really clear structured idea, perhaps a theme that came up earlier in the session, or a pattern that we want to explore further, that I am putting forth and asking the client to keep in mind while they're engaging in the art making process. And as treatment progresses and the family members' familiarity and comfort with the art making process grows, then I'm gonna dial back on the more structured art directives, and I'm aiming for giving more space for a more authentic, spontaneous engagement in the art process, and letting the client be more self-directed in the art making process. So my directives become much less structured, more open-ended as comfort grows and treatment continues.
So I've heard you talk about how you work with teens and children and parents to our team who are not art therapists. And I wonder if you could speak a little bit about just the way you talk to parents and the way you work with parents from a therapeutic perspective, not just from an art therapy perspective.
So yeah, there is a big difference between working with the parents of my teen clients versus working with my parents of my younger clients. Like, let's say you're in the state of Washington, let's say a child who is 12 and under. That's a very different way of working with parents, especially if my client is the individual. So is the minor client, and that's my minor child, and that is my client. So from the beginning of working with these parents, I really like to be really clear with both the teen, let's say teens, let's go with teens for right now, with the teen client and the parents from the get-go, to be very clear that the client is the teen, and that really for therapy to be as effective as possible, we need to create as big of a sphere of privacy as possible around therapy for that teen, to feel safe, to really be open and to feel safe and to share with me in session. Having said that, I do like from the beginning to plant a seed with the teen that it really is so helpful, and often the best way to help the teen is to work with the parent, is to help the parent help the entire family to know how to support that teen, which might mean being able to bring the parents into session, to be able to work together, all together at times. If the individual client is my teen, then I will work with the teen to try to gauge the comfort level of that teen in inviting the parents into the session. And that sometimes, I'll be honest, sometimes that takes time. Like sometimes I need to really work just individually with the teen client in order to build the trust And in order to really set some very clear boundaries that we all understand around what can be discussed with the parents and what won't be discussed with the parents, that is shared with me from the teen in the individual sessions. So there is a lot of, I'm tailoring this very much based on the teen's comfort level, as far as to what extent they're comfortable having their parents come into the session and work with us and do kind of more of like a family session, like family session style. I have some clients who are really comfortable with this. Some teen clients are just very comfortable and they really want their parents to be as involved as possible. And they really feel they don't have concerns about sharing information with their parents. That comes up in therapy. I have other teens who it takes a lot of work up front, and a lot of time to build the trust. And then at that point, it becomes so important that I am really being forthcoming about what exactly, and we're working together. It's a very collaborative process with teens. We're working together to figure out what can we share with the parents, how much would be helpful. And I always ask if there's anything that they do not want me to share with the parent.
If you are working with a teen from a therapeutic perspective per se, and you have a parent that's maybe difficult, how do you handle that?
When I'm working with a challenging parent in front of me, let's say a challenging parent, and a challenging parent is basically just one who, and I often remind myself this, a challenging parent is someone who's scared. The parent in front of me is someone who loves their child, who wants the best for their child, like all parents do. And I'm going to remind myself of that. I'm going to remind myself that this parent I can't see the road that they have traveled that brought them right in front of me to this moment, but I can pretty much bet that they're in a pretty desperate state when they come to me. Maybe if this is a teen who has a lot of challenging behaviors, or maybe a really significant history of trauma, and relational difficulties, well, then this parent I could be the fifth therapist that this parent has met with, and the number of doors that have been closed to them before they walk in. So I think that a lot of working with parents who are more challenging, dare I say, more resistant to treatment, I think is checking in with myself on how the lens that I am looking at that parent through, and having a lot of compassion for this parent, having compassion for the struggles and the fear and the vulnerability in coming to a professional for help with their child. And there's so much blaming of parents in our society for their children's emotional difficulties, behavioral challenges. And I don't want to add to that.
Let me just highlight something here. You're first of all, the idea that you're willing to engage and approach the parent, I think, is a huge obstacle. A lot of therapists that work with children aren't necessarily going to do it. They're scared to do it. They're not sure how it's going to go. They're resistant to doing that very thing that you make a point to do. I just want to highlight that you're willing to do that. And then this idea of understanding their experience and being compassionate about it. I just think that's so important, to understand that they want the best for their child, even if they're acting in a way that isn't the best for their child.
Oh, absolutely. Absolutely.
And then I'm assuming the last piece that I didn't hear you talk about, but I'm sure you do this, is even though you're approaching them with compassion, you're trying to engage them, you're trying to get them to overcome their resistance to being part of the process, you're also weaving in challenge for them, I assume.
Oh, yes.
Speak to that.
Well, absolutely, because absolutely. I think that interesting, as we're talking about this, I'm realizing that the process of working with more challenging parents, more resistant parents, is that you have to develop, just like you do with their teen children, you need to take the time to develop safety in that relationship. And to do that, you need to be able to communicate this understanding, this non-judgment, and this, like, I'm not here to blame you for your children's problems. No, but we can work together as a team. I'm also going to be talking to these parents about how you are the expert of your child, not me.
And the
Like
ally.
and a powerful ally. Parents are powerful allies for their children. And so really, like, I'm going to be coming to parents looking to collaborate. Like, we're on the same team.
Yeah,
And
I like that word team.
and I'm not going to be around forever.
And that you're kind of like a coach in a way.
Yes, I do a lot of coaching. I start with the parents and the family's strengths. I'm going to look for their strengths. I'm going to look for what they do really well, right? And I'm going to focus and I'm going to try to build on those first. Right. And then as I'm developing these more trusting, safe relationships, not just with the teens, but with the parents and the families, and they understand that I'm not going to be judging them like they have been so many times before. I'm not going to be telling them this is what you're doing wrong, or like, or that you caused this, or no, absolutely not. No, that I firmly believe that parents need to hear that they didn't cause their children's problems, but they can be part of the solution. Yeah. And they can help to make it better.
I just love that idea of it's approaching a parent is let's as a team try to work together in a way that will be beneficial for your child.
Absolutely.
Having the courage to approach a parent with that sentiment, I think, is so important. It's just, and I've watched you do it so well. And I've watched you do it so well with many difficult cases. A lot of what you're describing, I have a lot of familiarity with. I've done a lot of experiential work, and a lot of the tenets of what you're talking about really fit that modality. The idea that you're gauging the comfort level of the teen or the child, even in some cases, you're gauging their trust level. You're slowly building trust with them, and then you're presenting, from my perspective, you're presenting a challenge when you say, I would like to engage your parent or parents into this process so that there can be healing between you and the parents, if that's what's necessary, or there can be strategies that are, put forward that might be helpful, and really gauging their readiness. The idea of them having choice, I think, is so empowering for children to say, this is your choice, whether you want to do this or not. Here's how it could be helpful, but you get to decide. That's so empowering for children to have choice. And I just love that. When I did experiential work, we always called it challenge by choice. And so I want to bring that back around to this idea that art therapy is experiential and provocative in some cases. And I wonder if you could talk about that a little bit.
About art therapy and how it can be, it's powerful, right? It's like a powerful experiential. I love thinking of art therapy as being highly experiential. And I remember you saying one time that in an art therapy session, we're offering an experience, and that embeds in the memory in a totally different way when you're offering an experience to a client. And that is something that they could remember forever. It's something that they take with them. It's something that they won't forget. And I think that is so true. And I know that for those of us, particularly, because if we think about art therapy from an experiential perspective, from a sensory perspective, there's a lot of different senses involved, right? There's the visual aspect. And for those of us who have visual memories, like myself, I have a highly visual memory, then having that, there's something about having that image that of the art that it just embeds in the memory in this really deep way. And so one of the things that we do in art therapy is we keep the art that's made in session, and I put together like art portfolios for my clients. And that's where we keep the art that's made over the course of therapy, over the course of treatment. And so you can imagine, like, if somebody's doing art therapy for a while, you get like an art collection, like an art therapy collection over time. And it doesn't only have to be 2-dimensional. There's 3-dimensional art. There's sculptures, there's paintings, so you can picture, there's buildings, like there's crafts that I've had I've had enormous art, almost like installations that a client just kind of added to like over and over and over time. So you can imagine the portfolio, it doesn't necessarily just fit inside a folder. It could be quite a collection. But that as part of my process when a client is done with therapy or we're ending therapy is we will review the art portfolio from the beginning of therapy all the way through the middle to the end. And it's amazing to me the power of the associations and the memories that are tied to every piece of art. And the things that my clients remember, I always think it's so fascinating, the things they remember from looking at the art or looking at the image, and what stands out to them. What do they remember about the process of making the art? And it could have been 2 years ago, like if they've been in therapy for a long time. And the depth and the richness of their memories, I think, speaks to what you're saying, Bob, which is just that art therapy is very, it's evocative, it is powerful. So there's the visual sensory system being activated. It's very kinesthetic, especially particular kinds of art. Like if we're working with clay, that is highly kinesthetic. So there's that level of memory, auditory, like, there's also we're interacting like through the art making. There is a very significant, a lot of connection in that process, in me being there, witnessing, observing their process. I'm there alongside them as they're engaging in the art process. So there's that too. There's a relational aspect going on here too. So yeah.
I'm gleaning from this, again, I'm comparing a lot of this to the experiential work I've done. Is maybe you can speak to this, that in experiential learning, one of the things we really look at are metaphors. And the idea that this art representation is metaphorical of a process that's happening in my life, or a challenge that's happening in my life, or a conflict that's happening in my life. And so I'm wondering if you could speak to the idea of art therapy being metaphorical and also being diagnostic.
Yes, absolutely. I frequently talk about metaphors in my work, in my everyday work doing art therapy. And I think that is such a powerful construct. So when I'm doing art therapy with a client and they're making art, and this is particularly with children and teens, I would say, but I think this is true across the board. I see this also with my adult clients. Often what happens is that a metaphor emerges. A metaphor emerges in the art making. Sometimes one, sometimes multiple metaphors. But that is something that comes from the client. The client has put forth a metaphor, maybe through the imagery, or perhaps like when we're doing the art therapy session.
Can you give an example?
Yeah, a metaphor. Okay, so yes. Oh, let me think. What would be a good example of a metaphor? Okay, this is a great one. So something that can come up in the art is the imagery of a gate or some kind of a gate or a wall, right? Or a doors. Yeah, absolutely. These are all really powerful metaphors in the art therapy process. And it's one that comes up. It's a common one that comes up. I always like to pay attention when that comes up, and I frequently make a note to ask about it afterwards and just kind of be curious. It's very important not to make assumptions about what that metaphor stands for, right? So, because to me, a door or a gate or a wall could mean something completely different. So I am always practicing putting aside my own assumptions about those symbols, because it doesn't really matter what that symbol or what that metaphor means to me personally. I'm much more curious about what that means to the client and how that is significant to the client and what their association to doors and gates or fences, right? Boundaries, essentially, like, within the art product. So yeah.
So, for example, if a door to the client means I'm needing to open a new challenge in my life, or I'm needing to open a new idea, or I'm needing to close off something from the past, then I'm assuming that visual representation sticks in the consciousness, and then that can be used in their life as they're actually trying to carry that out. They have this visualization of,
Yes.
here's what it's going to look like, here's what I've made it look like, or maybe my next drawing is opening the door, or whatever the case may be.
I think it is so important to always stay curious, right? And to not make any assumptions about what is going on in the picture or how the gate is being used. It could be like, it could absolutely be, it could become a pattern. And I think that's another thing that we in the art therapy are always kind of on the lookout for, is patterns and things that are coming up in the art again and again and again, right? So elements of the art that are presenting in different art pieces over time. And there are times where you can see right in front of you, when you back up and kind of look at the whole art collection, and you look at like the journey and the process from beginning to end, you can see movement, like what you're describing. Like there's slight alterations in the metaphor, right? In the symbol, in the way it's being presented. So there are times, which is just very, very exciting times. Those are wonderful aha moments when you see, as an art therapist, when you see that, or when a client sees that, because I'm educating my clients on, like, here are some of the things that we're looking at when we're doing the art. Like, I am not at all interested in the aesthetic of the art product, but I am interested in how my client felt, what it was like for them when they were engaging in that art process, but also what meaning, when they kind of take a step back and kind of look at it, what meaning do they find in the art, and what patterns do they see? I teach my clients to kind of back up and look at the composition, even compositional elements of the art. Is there a lot of empty space? Is it more crowded? Is there organization in the composition of the art? And that frequently comes up as well. So there's a lot we're looking at with the art products.
So one of the things that I often do as a therapist is, without doing art therapy, I'm painting a picture, or even going to the whiteboard and drawing a picture of a metaphorical process that they're going through. Like I do one of a dam with a door at the bottom of the dam.
Yes.
And so the idea of something visual, whether you're actually drawing it or not, I find really fascinating. But it leads back around to a really important question I want you to speak to. Do I have to be an art therapist to do art in therapy?
Oh, that is such a good question. Oh my goodness. So no, I'm gonna say no to that, because it's like no. So in the sense of, like, I think this is a kind of a good parallel here that I think about, which is that I use play in my sessions with children and and teens too, teens. I mean, teens have their own ways of playing. So I use play frequently in my sessions, but I am not a play therapist.
Right.
And I cannot call myself a play therapist. That would not be ethical. So I am very careful. I do not claim that I am a play therapist, but I will say I use play as a tool in therapy.
Right.
Absolutely. And I think art is the same, is very similar.
Yeah.
I think that I know a lot of my colleagues who are great at using art as a tool for communication in their sessions and their work with clients, but they can't call themselves art therapists because they don't have the, like we were talking about, the certification, the registration, the licensure that would require. So they're kind of the distinction there.
So one of the things I often encourage students that I'm working with as interns and people that have associate license that I'm supervising, or just people on my team, is to conceptualize ways of being experiential. Conceptualize, I believe experience forms us, and it's experience that transforms us. And art, as we know, is highly experiential, as our other methodologies, highly experiential. And I'm not a marriage and family therapist, but I've worked with marriages and families throughout my entire career for 40 years. the idea that you have to have a certificate to do something, I think we're kind of squashing that idea. The idea that if you get certified in something and you get trained in it, you're going to be more effective, you're going to know more, you're going to use it more often like you do, you're going to use it as a huge part of your practice. But for those people out there who are not art therapists, who aren't going to become art therapists, this really is a modality that you can utilize.
Oh, absolutely.
And utilize it in a way that really works.
Absolutely. Well, and it is costly to be registered, certified, licensed in art therapy, just like it is really costly in time and money to become a registered play therapist. Like I have looked into that, and it is not cheap. It is very, very costly. So, and I completely agree with you. I think you do not have to be a registered art therapist to be able to use art effectively as a therapeutic tool with clients and as a vehicle for communication. It's just that, for me, I have the training and the education and the hours of experience, and I have the paper that shows that I'm registered as an art therapist. And so I can call myself an art therapist, and I can say I specialize in art therapy, which is a huge part of what I'm doing in my sessions with clients, no matter what my theoretical orientation is, because I tend to have a very eclectic theoretical style with my clients, where I truly am going to be using the theoretical approach that makes sense for the client in front of me. And even that makes sense, it could be even the same client, but in different points of therapy, I could shift. But the one thing that is constant for me is going to be the art therapy. Like, I will be doing the art therapy integrated into all the stages of my treatment with all of my clients. Like I said, to some degree, I'm going to be doing a lot more. Some, perhaps it's more supplemental to more traditional talk therapy. I also, just as I've continued to work at A Better Way and learn from you, Bob, I am looking for more ways to give experiences to my clients beyond just art therapy. Yeah. So that is, I think that for me, the longer I'm at A Better Way and learning from you, I'm thinking I'm more and more outside the box. It doesn't just have to be art. There's so many ways to give experiences, meaningful experiences to clients based on their strengths, based on their interests, based on what they're working on in therapy.
And their willingness.
Yes.